joined by Professor Stephen Langley, who is Professor of Urology working in Guildford at the Royal Surrey County Hospital, the Guildford Nuffield, and also the London Bridge Hospital. Stephen is currently chair of the Surrey and Sussex Cancer Alliance in Urology, and he's going to talk to us a little bit about prostate cancer and screening. But maybe I could start, Steve, with a question is, how did you get involved in prostate cancer in the first place?
Well, I've been interested in prostate cancer, which is a fascinating disease, since I was a junior doctor over 25 years ago, and I spent a lot of my training in Los Angeles learning the latest surgical techniques at that stage. And when I started practice as a consultant, it just seemed to me that we could improve both the diagnosis and the treatment of the condition. It's such a common condition, and yet the diagnosis was difficult and the treatments often had a lot of side effects. And really that's been my career, my passion to improve this all too common disease for men, in both identifying men with it and being able to cure them if we can get them early, if they've actually got it.
I think that's amazing. I think we're lucky to have such passionate and skilled people in our sector, and we'd like to learn just a little bit more about the prostate. And what does it do? What does it naturally do?
Well, the prostate is a gland about the size of a walnut, sits just below the bladder, and the water pipe runs through the middle of it. It sits in front of the rectum. It's involved in the ejaculatory process, and as a gland, it makes some secretions that form part of the constituents of the seminal fluid. It's also got a few key structures around it. The circular muscle that keeps one watertight, the sphincter, is integrated to the prostate. And the nerves that run on to innervate the penis and generate erections run on the surface of the prostate. So it's right in the middle of an awful lot of clockwork, which makes it both a difficult organ to access and very challenging when we treat it, so that we don't damage any of those surrounding structures.
And what is prostate cancer, and how commonly does it affect men?
Prostate cancer is unfortunately now the most common cancer affecting men, with 55,000 men a year in the UK being diagnosed with it.
Wow.
Over 12,000 men now die of prostate cancer each year. It's a major health issue for men. More men are dying of prostate cancer than women of breast cancer. And
Wow.
yet it has received a fraction of the awareness, the funding and the research to date. But that's changing. And cancer, as with any area, is when the tumor within the prostate able to grow in a unregulated, discoordinated way, and then the cancer can break out and spread to other parts of the body. And that's the same as it is in prostate cancer.
And what kind of symptoms might people experience then with this cancerous process happening?
Well, this is the key issue, is that early prostate cancer causes no symptoms. So if you want to know if you might have prostate cancer, you have to be checked. Because just as any early tumor, it's small. It's not going to cause any of the symptoms that we typically associate with the prostate, such as a poor stream, getting up at night, frequency or urgency. Now, when the disease is more advanced, then those symptoms can occur. That doesn't mean to say those symptoms are symptoms of advanced prostate cancer. They're symptoms normally of a benignly enlarged gland. Other symptoms of more advanced prostate cancer can be bone pain, particularly in the spine, blood in the urine, and sometimes unexplained erectile dysfunction. But for most people, when they present to me with prostate cancer, they have no symptoms attributed to their prostate cancer.
So it sounds very much like we need to be catching this early, but in people without symptoms. So how do we detect people? Do people need to be examined?
Well, the good news is that most men don't need to be examined. And it's really changed unbelievably in my working lifetime here. It starts off with a simple blood test for PSA, that stands for Prostate Specific Antigen. That's an inexpensive, relatively cheap blood test. And as of 2005, it is the right of every man in the UK to have their PSA checked. If they're suitably informed about the pros and cons, because for any test there can be under detection, and not every test is perfect. Now, the real game changer, though, in the detection of prostate cancer is if the PSA, the blood test, is abnormal, then before examination, men undergo an MRI. And the MRI has enabled us to really determine whether or not someone may have an early cancer. And if they don't, and if the MRI looks normal, we can often reassure men and say, look, it's okay, your PSA is up a bit, perhaps because you've got a big prostate, benign prostate gland, there's nothing to worry about. So it's only after the MRI, if there's again an abnormality, would they go on to have a biopsy. And really, that's the key moment that we can determine whether or not someone has prostate cancer or whether they're in the clear.
And I think a lot of people will be interested in how they can avoid increasing their risks of prostate cancer. There's certain things that people are doing that might increase their risk.
There's not an easy way to eat your way to a healthy prostate. There's an awful lot on the internet suggesting you can do, but let me tell you, unfortunately, very little of it is scientifically proven. Avoiding obesity, clearly that's good for your heart and for the rest of your body's physiology. So staying reasonably in shape and eating a healthy, balanced diet, I think, are the best things you can do. Prostate cancer, like many cancers, it's a genetic problem. And so men at most risk are those with a strong family history of prostate cancer. If their first degree relative, a father or brother, might have the disease. Or if they're of Black ethnicity. In that group of men, there's a greater risk of developing prostate cancer as well. But there's not an easy solution to taking a supplement to avoiding the condition. I just wish there were.
I don't know. I think we're all looking for those holy grail type moments in medicine. So this is a really positive story about screening for prostate cancer. So why is there no national screening program currently?
Well, I'm hopeful that later this year there will be. It's the
Oh, wow.
advent of MRI has really shown that we can now identify men with prostate cancer and just identify those at risk. Screening studies across Europe have shown that regular PSA testing reduces death from prostate cancer. The trouble was, we were detecting a lot of men who perhaps were never going to succumb to their disease anyway. And now having the MRI in the middle of our diagnostic pathway really means that those men that we needn't worry, we're not going to biopsy those. We're really going to only biopsy men who are likely to have significant disease. In Europe, they have agreed to roll out prostate cancer screening across the EU member states. Sadly, we're not one of those anymore, but the UK National Screening Committee is meeting later this year, and I believe with the new data that's available, they're going to change their stance. And I would like to think that in the beginning of the new year, we may see the beginning of a targeted prostate cancer screening project in the UK.
Well, that would be hugely exciting. I think in my 30 years in medicine, I've seen this evolve from a primary care perspective hugely, and we've gone from labelling the PSA as a persistent source of anxiety to something that seems much more focused and much more targeted, much more accurate in detecting cancers early, particularly with the technological change that you've described around the MRIs and more targeted biopsies. And I think for people who have experienced prostate cancer or just getting a new diagnosis, one of the big questions, of course, will be just how treatable and curable is this?
Well, as with most cancers, if we can detect it early before it's spread outside the prostate, it's very curable. And our cure rates are between 80 and 90% for most early cancers. So that's the real importance of getting it early, because if it's later and it's spread, then cure becomes less possible. And if it's actually spread to the bones, then men aren't curable. That doesn't mean to say we can't treat them and extend their lives for many years. But what we really want is to find cancers when they're confined to the prostate. And that's when they have the different treatment options available to them, and they're most likely to be cured of their condition.
Steve, I cannot be more delighted that you've joined us to talk to our patients and more widely our community in Walton, Weybridge and Hersham. very clear message about screening, very clear message about early detection. I think for any of our patients who are watching, currently there is no national programme, but if you are interested in having a test, please contact us here at the surgery. Obviously, if you're registered with a different surgery, I'm sure your GPs would be happy to have that conversation too. We know that we should be looking at PSAs. I think I'm right, Steve, for men between 45 and 70 from a Black and minority ethnic background, and more generally for men between the ages of 50 and 70. Oh, and obviously primary first degree relatives. So fathers, brothers with prostate cancer, we'd be happy to offer you a PSA screening as well. I'm so thrilled. Thank you. We will leave all of the details around screening and around how you can access screening in the details at the bottom of this video. Thank you for your time.
Pleasure. Thank you.